Today we are introducing the newest FDA-approved hyaluronic acid product. It's Restylane Contour. This is approved for cheek contouring and for improvement of cheek volume in the mid-face. And what I really love about this is it is soft and supportive, and it's going to look beautiful, not only at rest, but with animation. I'm a little pink, not to match the box of Restylane Contour, but because I just had a peel. But we are lucky enough to have one of our patients that was in the pivotal clinical trial. So I was one of 15 patients that about 3 years ago was treating a select group of subjects with Restylane Contour to actually get it FDA approved, and the day has come. So it is time for touch up, and we're going to do that today. In the study, we were just treating kind of the middle part of the cheek, but actually on our gorgeous patient, we're going to treat on her left side a little bit of the outer cheek as well. She tends to sleep on the left side of her face. It's a little bit more flattened on what we call the zygoma, and we want to give her a little bit of that gorgeous pop on her cheek so that she has beautiful light reflection. She loved this product in the study, so this is really like kind of a homecoming, isn't it? We actually get to treat you. So you lean your head back. All I'm going to do right now, we always want to start with sterile technique and then safety. So actually interesting in this study, we were one of the sites where we treated patients split face on one side with a needle and on one side with a cannula. So I'm actually going to demonstrate both of those in the same patient. And so I typically will use a needle kind of to just inject on bone in areas that need support along the cheek. But in this mid-face, there's some really important vessels, and we want to, start with safety first. So I'm actually going to inject with a cannula in that area. So I start with little numbing dots. So I'm going to put a baby bit of some lidocaine with a little bit of epinephrine in what's going to be the cannula sites in the middle part of the cheek. So our gorgeous patient's just going to feel a baby sting right there, okay? 1, 2, 3, little baby sting. I'm going to come over to the other side, and we're going to do the same thing. Poke over here. 1, 2, 3. Good. And while those are kind of just numbing up, which is pretty instantaneous, but we're going to let them sit for a second, I'm going to treat her left side of her lateral cheek with a little bit of the contour, because I just see flattening on that side versus the other. And I want to be right on bone. Perfect. We're going to do just some little baby dots. I like to start with the lateral part of the face first, because that's kind of like our supportive framework. It sits behind true ligaments, and so if we can do that, I think we get a little bit of better anchoring with that. Come back to center. Beautiful. I'm going to do a little last dot here, and I'm on top of what we call periosteum, our bone. And even with that, you can see that beautiful cheek shadow that's actually coming back. I'm going to get in the way of the lens just for a second to make sure that we're getting pretty even, Stephen, and we are. And now that I've corrected this, I see flatness that's there. So we're going to do one more final dot before I do the cannula work in this area too. 1, 2, 3. And I'm right on top of bone, which is a safer plane to be injecting. And I bet that looks just absolutely gorgeous. So in the study, we have a year approval with this product, and what we found at the conclusion of the study at 48 weeks was that most patients, about 63% of them, still had an appreciable change that was viewable on their face, and that looks so pretty. And I actually want to do a dot here, if you'll let me just do a baby dot in a couple of areas, and then we'll work with the cannula. We're not going to need to use as much because her sleeping side was on the other side. It was her less full side of her face. And I just want to do little pillars of this hyaluronic acid product just to give her, again, that cheek shadow, and you can start to see that. One last final dot here, close to where that area of light reflex should be. And that's beautiful. And now we're just going to focus on doing a little bit in the medial cheek, and we'll be done. So in order to use a cannula, which is a blunt shaped tube, I had to make a little entry point. I like to numb it first so that she doesn't feel me making this little entry point. And from that, I'm going to insert a cannula. In this case, it's a 25 gauge. So you can see that. And I'm placing this on top of the bony support here. So I just want to put a small amount, probably the equivalent of about 0.1 cc there, to give her that continuous, beautiful cheekbone. And that is just about as gorgeous can get. Can you smile for us? And it looks so pretty and natural. I'm gonna finish up on the other side, but I'll do that off camera. Again, this is Restylane Contour. It's the newest hyaluronic acid product and an expression technology that's available in the Restylane expression family of products. We were, again, one of the sites for investigating this, and I'm so happy now we can provide it to our patients at large and give a little top off to one of our clinical trial patients. So thank you again for coming and being a part of it. If you have questions or want answers, you can contact us either at artofskinmd.com or you can call us at 858-792-7546.